My late mother, Lynn Shin, was diagnosed with stage 2B rectal cancer when she was about 37 to 38. She received radiation therapy at first to shrink the tumor, and then went through surgery to take out the tumor, and then chemotherapy. It was about an 18-month journey, and after that, she was in remission for about 9.5 years. In the early 2000s, she started feeling more and more uncomfortable and had trouble walking and had severe pain in her legs. She was going to all of her checkups and there was no rectal cancer found, and instead she was diagnosed with osteoporosis. She was treated for osteoporosis with steroid shots and it didn't help. And then finally one day she decided that she wanted to go to the ER. She lost a lot of weight and could barely walk. She asked my father to drop her off, and so he did, and she walked herself into the ER. After tests and scans, it was discovered that she had a recurrence of rectal cancer. The tumor had grown on the right lower side of her spine, and it was pushing up against an artery, which was giving her so much pain down her leg and the difficulty of walking. At that point, her oncologist diagnosed her with stage 4 terminal rectal cancer and a maximum of 2 years to live. So this was around May 2006. I was a sophomore, finishing my sophomore year in college, and she had to be on chemotherapy for the rest of her life. After several rounds of chemotherapy, she did reach a point where she became tolerant to her chemotherapy and she was no longer responding. And then her oncologist presented clinical trials for her. She went through several clinical trials after another. After one didn't work, she went to the next one. They helped, and she actually lived 4.5 years post her reoccurrence diagnosis. She was able to be present at my college graduation and was able to move me to Florida to go to grad school. And without clinical trials, I wouldn't have been able to get that time with her. So thank you for all the researchers out there that are doing this to help rectal cancers especially.